Today's topic of discussion is anatomy of palate. I'm Dr. Muhammad Sharjeel Ilyas, assistant professor in PGMI AMC Lahore. Objectives of today's topic are to learn functions of palate, anatomy of hard and soft palate, muscles attached with soft palate, neurovascular supply of hard and soft palate, and applied aspects. First of all, functions of palate, especially soft palate, performs isolation of mouth from pharynx. Actually, it isolates the mouth from the oropharynx during chewing so that breathing is unaffected. It separates the oropharynx from the nasopharynx by locking Passavant's ridge during the second stage of swallowing so that food does not enter the nose. In summary, it restricts entry of food into the nose by varying the degree of closure of the pharyngeal isthmus. The quality of voice can be modified and various consonants are correctly pronounced. So it helps in speech production. During sneezing, the blast of air is appropriately divided and directed through the nasal and oral cavities without damaging the narrow nose. Similarly, during coughing, it directs air and sputum into the mouth and not into the nose. Now, a little bit anatomy of palate. We divide palate into two parts, a hard part which is called hard palate and a soft part which is called soft palate. Hard palate comprises most of the part of the palate, like five sixths of the palate, and one sixth of the palate is comprised of soft palate. Hard palate is a partition between the nasal and oral cavities. Its anterior two-thirds are formed by the palatine process of the maxilla. In purplish color, it's palatine process of maxilla which forms anterior two-third, and its posterior one-third is formed by horizontal plates of palatine bones. Definitely two suture forms, intermaxillary suture between the palatine process of maxilla and interpalatine sutures between two horizontal plates of palatine bone. They meet at the point where a cruciform suture or cruciform structure is formed, as you can see in the picture. Now, openings in the hard palate. There are three main openings. First of all, incisive fossa, comprising incisive canal. This incisive canal contains nasopalatine nerves. Nasopalatine nerve is a branch of maxillary nerve, which is a branch of trigeminal, second domain of trigeminal nerve. It contains sensory fibers, so sensory supply from this area is taken by nasopalatine nerve. While sphenopalatine artery is also present, it is a branch of maxillary artery and it supplies mucous membrane of the hard palate. The second opening is greater palatine foramen, contains greater palatine nerve. This nerve is coming out from pterygopalatine ganglion. It contains sensory fibers from maxillary nerve, which is the second domain of trigeminal nerve, and also parasympathetic fibers from facial nerve, actually the nerve to the pterygoid canal, and sympathetic fibers from the same nerve to the pterygoid canal. It contains descending palatine vessels. There are two types of vessels, greater palatine vessels and lesser palatine vessels. Both of them supply hard and soft palate both. The third opening is in pyramidal process of palatine bone, contains lesser palatine nerve. It's also a branch of maxillary nerve. This is a picture of palate showing hard area represented by 1. The anterior lateral boundaries are bounded or contains teeth and sockets of teeth or alveolar process of maxilla 2 and 3. And posteriorly, there is soft palate presented in the picture. So before discussing the muscles of the soft palate, as only soft palate contains muscles, uh, there are 5 muscles of soft palate, but we divide into groups of 2 and 2. The two groups, the members of the first group is tensor balli palatini and levator balli palatini. He gives attachments superiorly to the palate, while palatopharyngeus muscle and palatoglossus muscle they give attachment to the inferior surface of the inferiorly to the palate. So they have different functions accordingly. We will discuss their origin, insertion, and function separately. Especially this muscle, which is tensor velli palatini. It is very important muscle and very important to discuss as of its attachments. It originates from the medial pterygoid plate of the sphenoid bone and inserts into the palatine of aponeurosis. Palatine aponeurosis forms on the posterior border of hard palate. Now, this is the bony structure of skull inferiorly. We can easily see scaphoid fossa. It's part of medial pterygoid plate. So the origin of the tensor velli palatini is from scaphoid fossa, and then it takes turn around or loops around this pterygoid humulus and give insertion to area where palatine aponeurosis is present. We can see in this picture path of tensor velli palatini muscle around pterygoid humulus and its origin and insertion origin from scaphoid fossa of medial pterygoid plate and insertion in palatine aponeurosis. Another picture showing tensor velli palatini muscle having the origin from scaphoid fossa taking out around turn around pterygoid humulus and inserted into palatine aponeurosis. The second muscle is levator velli palatini. Okay, this muscle, levator velli palatini, arises from the petrous part of temporal bone and especially from the eustachian tube before inserting into the palatine aponeurosis. This is again tensor velli palatini showing it's a repetition of the slide showing origin from scaphoid fossa, taking a turn around pterygoid humulus and then inserting into the palatine aponeurosis. But we are talking about this muscle, which is levator velli palatini. Levator velli palatini is actually take origin from eustachian tube and petrous part of the temporal bone and inserted into the palatine aponeurosis. Levator velli palatini elevates soft palate and closes the pharyngeal isthmus. It also opens the auditory tube. And tensor velli palatini, it also tightens the soft palate chiefly by anterior part, opens the auditory tube to equalize air pressure between the middle ear and the nasopharynx. So both of the muscles, tensor velli palatini and levator velli palatini, they tightens the soft palate, elevates it as their origin is superior to their insertion, and they opens the eustachian tube to balance the air pressure between middle ear and pharynx. Now, the nerve supply of these muscles, all of the muscles of palate are supplied by vagus nerve. especially the pharyngeal plexus formed by vagus nerve and cranial part of the accessory nerve, except tensor valli palatini, which is supplied by mandibular division of trigeminal nerve. This is the only exception. This is our third muscle, which is palatoglossus, attached with the tongue. It originates from the palatine aponeurosis. The origin is now from palatine aponeurosis and travels anteriorly, laterally, and inferiorly to insert into the side of the tongue. Functions pulls the soft palate towards the tongue. Actually, during the first phase of swallowing, it closes the area. This is the fourth muscle, which is called palatopharyngeus, arises from palatine aponeurosis and the hard palate, and inserts into the upper border of the thyroid cartilage. Now, the origin is from palatine aponeurosis of palatopharyngeus as well as palatoglossus, and their insertion is inferior to their origin. So, they also tenses soft palate and draws the pharynx anteriorly on swallowing. Now, especially the palatopharyngeus pulls up the wall of the pharynx and shortens it during swallowing, while palatoglossus pulls up the root of the tongue, approximates the palatoglossal arches, and thus closes the oropharyngeal isthmus. So both of them they are working during the swallowing. This is muscular uvula in the midline, while in the yellow color we can see palatine tonsils. So the palatoglossal arch containing palatoglossus muscle is anterior to the palatine tonsil, present anterior to the palatine tonsil into the palatoglossal arches, while palatopharyngeal muscles are present in palatopharyngeal arch posterior to the palatine tonsil. Again, this is palatine tonsil, and these are palatoglossus and palatopharyngeal muscles, respectively, anterior to the tonsil and posterior to the tonsil. And this is the fifth and final muscle, which is called musculus uvulae. It arises from the posterior nasal spine and the palatine aponeurosis again and inserts into the mucous membrane of the uvula. So three of the muscles take origin from palatine aponeurosis: the palatoglossus, palatopharyngeus, and muscular uvula. While the other two, the tensor valli palatini, takes origin from scaphoid fossa medial pterygoid plate, while the other one, levator valli palatini, takes origin from eustachian tube and petrous part of temporal bone. While they are both of them are inserted into the palatine aponeurosis. There is a huge functional role of palatine aponeurosis here. Here you can see the muscular uvula. It actually pulls up the uvulae, this muscle. Discussing nerve supply of palate, it is very important to understand three types of fibers: sensory, parasympathetic fibers, and sympathetic fibers. Sensory fibers are coming from second division of trigeminal nerve, which is called maxillary nerve, while parasympathetic fibers are coming from facial nerve through greater petrosal nerve. Here they come and unite and nerve to the pterygoid canal. The sympathetic fibers coming from superior cervical ganglion and forming internal carotid plexus, and they just join the nerve to pterygoid canal. So in the nerve to the pterygoid canal, there are sympathetic and parasympathetic fibers. The parasympathetic fibers, there are also some taste fibers with parasympathetic fibers. They are coming from greater petrosal nerve too. So their nuclei will be tractor solitarius, while the superior salivatory nucleus will be the nucleus for parasympathetic fibers. So now these fibers they come and reside under to the pterygoid canal. They meet with the sympathetic fibers there, and they just travels towards pterygopalatine ganglion. Now the pterygopalatine ganglion and the pterygopalatine fossa is hanging with the yellow maxillary nerve. So all of these fibers they combine, and a branch coming out from pterygopalatine ganglion is greater palatine nerve. So the greater palatine nerve contains sensory fibers, parasympathetic fibers, taste fibers, and sympathetic fibers. These four types of fibers they just travel along greater palatine nerve through greater palatine canal and opens into palate through greater palatine foramen. The area marked in blue, the colored in blue, is the area which is supplied by greater palatine nerve. So all the glands and maybe uh, posteriorly some of the taste fibers, they are supplied by greater palatine nerve. Anteriorly, the incisive area is supplied by nasopalatine nerve. This nerve is coming out from incisive canal and it is also a branch of maxillary nerve. While posteriorly from lesser palatine foramina, which are maybe 2 to 3 in number, the lesser palatine nerve come out from this area, actually from the pyramidal process of palatine bone, and supply the area shown in green. This is the anomaly. This anomaly is called cleft palate. Very common anomaly. Here we can see a newborn child having cleft palate, cleft lip, and there is a cleft of both soft and hard palate. And the picture B represents the closure of cleft lip and cleft soft palate, while cleft hard palate is still persistent. Uh, there is time for closure of these surgical closure of these clefts. So in the picture, it's not the time to close the hard palate, while soft palate and lips are closed. So this is all.